Mrs. Tanner. How are you feeling today?
A bit better. I can breathe better today. But I'm so tired.
Yes, pneumonia can be difficult, but we caught it early enough that you didn't have to go into the intensive care unit.
And I'm so happy about that. I wouldn't have wanted to be hooked up to all those machines.
Well, let's talk about that a bit. We need to discuss what would be best to do for you if you had gotten worse.
What do you mean? You're the doctor. You would have known what was best to do.
Actually, Mrs. Tanner, it is partly about your values and preferences. If you were to get worse and your lungs started to fail, if you didn't go to the ICU, you would most certainly die. However, if we did send you to the ICU, you would most likely survive. But you may also end up much weaker than when you first came into the hospital.
Why is that?
Well, research shows that a percentage of people over 80, like yourself, they don't fully recover after being in the ICU. There's certainly a greater chance of survival because we do use many treatments, but you may have a very different quality of life afterwards. For example, you may not be as mentally aware, or you may be physically weaker and not able to function as before.
I never thought about that. I am frail, but I still have my mind and I'm able to think for myself.
And another thing to think about is if you were to get worse and actually die in the ICU, it may not be a very natural death. And having a more natural death might be important to you. That's why we should talk about these things.
That's a lot to take in. I guess my first thought is if I'd gotten a lot worse, I just wouldn't have wanted to go through all of that. I remember my aunt dying in ICU. It wasn't pretty and not at all dignified.
Okay. We will leave you with medical care as your overall goal of care and not recommend admission to the ICU. Now the good news is you're doing better now, and I expect you to make a full recovery and return home. Now I would recommend that you discuss your wishes for medical care with your family doctor and your family. That way if you do get sick again and can't speak for yourself or make decisions, they'll know what's important to you and will be able to make decisions that respect your wishes.
That's a good idea. Thank you, Doctor.
You're very welcome. I just want to make sure you get the medical care that's right for you.